Hello and welcome. My name is Barkha Dutt. We are on the ground in Tamil Nadu. At this point, I'm in a small village in Salem. Tamil Nadu in the last 24 hours has registered, in fact, a huge number of COVID cases, being the state in this last 24 hours that has contributed the maximum number of cases. So remember, the wave keeps shifting. There was a point when Maharashtra was at the top of that chart. Now in this past day, it is Tamil Nadu. We are traveling across India, not from behind a sanitized little table or inside a studio. We were in Karnataka, now we're in Tamil Nadu, bringing you voices from the ground. But the one voice from Tamil Nadu who's really been attracting the headlines in the last few weeks is Tamil Nadu's new finance minister, Dr. Thiagarajan. He's somebody, and we can play some pictures as we bring him up. He's somebody who has been a banker on Wall Street. He's a graduate of the MIT Sloan School of Management. He has, of course, a family that has a long history in politics from the years of the Madras Presidency. His family has also been closely associated with the management and the consecration ceremonies of some of the key temples of Tamil Nadu, something that led him to a ferocious battle, as it were, with Jaggi Vasudev. But at the moment, he says he's concentrating all his energies on the COVID management of this state, which is, of course, the most important thing to talk about, alongside the economy of not just Tamil Nadu, but of course the country as a whole. Let me welcome Dr. Thiagarajan to the program, the Finance Minister of Tamil Nadu, and great to have you with us. Namaskar and thank you. I've got to start by asking you. Before the DMK government won the elections and is now leading Tamil Nadu, you were making the point that the previous government was fudging the data. And I personally, as a reporter who's traveled across India, has found that happening in every state. The huge, gigantic gap between our official data and how many are actually dying from COVID. Now that you're in government, how accurate do you find the data, the death data to be, and what are you doing to make it more real, both the cases and the fatalities?
Yeah, I think that's a very good question. I think, we all take direction from our chief minister, and he was very clear the minute we came to office. He said, there's no point in hiding the data, trying to fool people. I want transparency. I want real data. Part of that is, that is partly the explanation why the second wave in Tamil Nadu has been 5 times, 6 times the peak of the first wave. The first wave never registered more than 5,000 or 6,000 cases. We're now registering 30, 40 cases. At the peak, we've come a lot since then, 30-something thousand cases. But there's a separate problem. The separate problem that happened all over the world is this notion of excess death. So excess death is, first you have to have a baseline. What were the number of deaths in this area, in this period, and a non-COVID time, 2019 or 20? How many deaths can you clearly attribute to COVID at this time? Of course, there's fudging in that data. But if you were to add A plus B, you'd find that today's death counts are even higher than that. And that happened all over the world. It happened in Italy, it happened in America, it happened in London, it happened everywhere. So what I had been saying when we were in opposition is, let's start plotting the total death numbers so we can look at excess death as an indicator, particularly because we're not testing 10, 20,000 RT-PCRs a day. Now we're testing 160,000 RT-PCRs a day. So anyway, long story short, there is still a gap between what the government considers to be COVID deaths and what we find in the crematoriums. The distinction is, in our government, we actually publish the crematorium data, even though we know there's a lag. So, for example, in Madurai, the government data shows 20 or 23 deaths out of it in the hospitals that the government tracks. We track the crematoriums and find there are actually 50 or 60 deaths. Now, these excess deaths could be explained many ways, as you know, dialysis patients who otherwise did not get it, or, accident victims that could not get ICU. There's many reasons you could have excess deaths or mental depression. But I would say that because we have tracked the deaths in a scientific way to help us decide which way, the trend is going, has been one of the reasons that Tamil Nadu has greatly brought the second wave under control. And in particular in Madurai, we are about 1/3 the levels of the peak of 2 weeks ago. Within 2 weeks, we've been able to flatten the curve that dramatically for this, among other reasons.
You make a really interesting point about using the crematorium data, and I just want to clarify with you. Are you saying that in Tamil Nadu, there's been a conscious effort to bridge the gap between the cremation ground data and the official data, and you're treating cremation ground data as official data? And I asked you this because I was in one of the 3 crematoriums for COVID cremations in Salem, and the cremation manager told me that there's been a tenfold increase in the deaths in the last, couple of weeks. And are you saying that as a state government, you are ready to be transparent, you are ready to accept cremation ground data as official data? Because in all the other states I've traveled to, there's a huge gap between crematorium data and official data.
Yeah, and let me be a bit more precise. The leader's view is the leader's view. He says transparency, get everything done. Then he sent us off to our respective districts. I came to Madurai district where my constituency is. Every district took a slightly different approach because we all got hands-on and we took control. We who talk about federalism and states' rights also then power should be devolved to the districts and the panchayats and the district unions and so forth. So we have taken a district-wide approach. In Madurai district, we did notice that the crematoriums were getting backed up. So we did 2 things. The first is we started tracking that data daily, at least at management level. I'm not 100% sure what's being published to the public, but at the management level internally, the collector, the monitoring officer, the ministers, we set up that is a bit unique to Madurai district, I think. We took a very scientific, distributed, kind of quantitative approach. And what we did is we realized that we would need more crematorium space. So just as we are setting up oxygen plants right now, should there be a third wave, that we will be oxygen dependent. In Madurai district, oxygen, in another 2 months, we can generate 8,000 liters per minute using CSR funds, and industrialists were qualified to do this. The same way we started construction of additional crematoriums, just to make sure that should there be a problem like this. I'm very happy to say that the crematorium utilization rates have dropped by more than half. They are now about 1/3 of where they were at the peak 10 days or 15 days ago. We are not going to stop. We're still going to build the crematorium. But you see, a crisis like this requires distributed decision making. This requires many brains and many kind of specialists to be involved. And so I can say for sure, I'm not tracking other districts that I already have workload that is quite high between my MLA work, the district work, and my ministry. So I'm not actually looking at COVID in other districts. It's not my day job. But in my district, we have certainly tracked it as clear and beyond the statistics that are coming. Because there's all these lags in the system, as you know. Even the tests are taking 24, 36 hours. So we had to ramp up the testing technology. We had to get additional machines. We found that all the samples were coming in exactly the same time. Though we had the capacity to process, let's say, 14,000 tests a day, all the samples would arrive at exactly 9 a.m. And then they'd get dry. So we tried to go shift-wise. But then you can't make people work like middle of the night to deliver samples. So then we had to get parallel processing capacity, that even if we're only going to process 12,000 or 13,000 tests, you must actually have machines to process 25,000 a day, because in fact the samples arrive at a bulk at a time. So these are things we learn, right? I mean, we're not perfect, nobody before. We learn and we fix, and there's enormous resources available, the goodwill of society, of industrialists. We are now oxygen self-sufficient, at least in terms of concentrates. In 2 months, we will be in terms of generating plants. That's amazing. That kind of outcome is really unimaginable. If you're outside the system, you need how much the system can generate.
What do you have to say about vaccine shortages? And I ask you this at a time when the High Court in Delhi has been absolutely merciless in actually its assessment of the central government's vaccine rollout management. The Delhi High Court said that some people should be charged with manslaughter for not tapping the vaccine manufacturer's potential. They said there was palpable disquiet in the country, and they also said that this was a tearing emergency. And I can tell you, Dr. Thiagarajan, the villages even in Tamil Nadu that I have been to, the rural villages. I was in Hosur, I was in Salem. They say that villagers are scared to travel to the towns and cities to get a vaccine, and they say the villages don't have enough vaccines. Now, what are states doing about this, and how do you see those comments from the Delhi High Court that some people should be charged with manslaughter?
Look, whenever I speak my mind, I get a bit in trouble. So I'm trying to be very diplomatic today. Let me
No, no,
break this
please
into
don't
two
be
different pieces.
diplomatic. Please
The
don't be
first piece
diplomatic.
is
Please don't be
assuming.
diplomatic. Yeah.
Okay, let me be as technical and as calm as possible. Let me break it into two different pieces. The first is, were you to have vaccines, how quickly can you administer them and can you get them to the rural areas? Again, I say, what we learned in Madurai is that a distributed strategy works. Forget the vaccines. Even for treatment, had we been waiting to have people come to the government hospital in the city, we would have created a kind of explosion of cases because we would have had transmission between the rural and the urban areas. See, containing something in urban is quite easy. You have good infrastructure, you have good mechanisms to track. The spread is wild because the density of population is, but tracking treatment is easy, infection is easy. The ambulance can get there in 10 minutes. Once the spread crosses that tipping point and goes to the rural areas, you're in serious trouble because you don't have connectivity of infrastructure, you don't have connectivity of ambulance, you don't have medical services, etc. So we took a conscious strategy. My minister, commercial tax minister and registration department minister P. Murthy and I, that we would go distribute it from day one. So what that meant was we ended up taking every primary health center. Now we are in Tamil Nadu. The Dravidian model has given us some advantages. We have lots of doctors, we have lots of primary health centers, we have lots of nurses. So we dispatched and we said every panchayat, every township, every district union, we must have capacity. We must do testing there, we must do vaccination there, we must have 10 to 50 beds starting with the village to the union where we can have a medical nurse and a practitioner on call, and we can do basic, anything that is not required oxygen will be in that area and they will never need to come to the city. And then we set up to expand the second government hospital in Topur, which was a rural kind of a, British days set up for infectious diseases, remote kind of open 100-acre little buildings place. We went and had the sponsors come and create 400 extra oxygen beds with tent city like situations. And so, we focused on the one hand, strengthening infrastructure, on the other hand, distributing the reach of all of these things. And my colleague Murthy had an even better idea. He said, why should we come to the village office or the panchayat or the Anganwadi or the noon meal scheme, which is not working now, where we set the beds? He says, let us go survey them at the home. So we got self-help groups, the women self-help groups. We got 3,800 and something women. And the government paid them to go and actually survey every house and find people with symptoms before they came to us and bring them to the village areas and get them treated there itself. Paper on this. But my instinct is that the smart thing we did was for local self-governance, local administration down to COVID and get this taken. This is one half of the equation. Now let's go back to the other half of the equation. We have the exact opposite situation when it comes to vaccines. We don't have a free market. A free market is where there are many buyers, many sellers. There's no price maker, and supply and demand determines fluctuating prices. It's an open, normal, functioning, efficient market. We don't have that. We have structural problems. We have authorities like the Union Government of India that decides which vaccine is acceptable and not. We have authorities, we have monopoly or monopsony kind of buying, selling situations. In fact, right now we have oligopoly. There are only 3 manufacturers who sell vaccines that we can buy. Now, if you make it a free-for-all and say, 32 states go and bid, you see what has happened. The rich states of Maharashtra and Tamil Nadu have been able to float global tenders, though they have not been filled. But the other states don't have the money to do that. So, realistically, when you have an oligopoly situation, where only 2 or 3 manufacturers exist, the smart way is to have a monopsony buyer like the government of India, who can then have greater power than the oligopoly suppliers, buy everything at a fixed price and distribute it to the rest of the system. So that is how it is supposed to work. Now all of a sudden you have the government, Union government of India, which otherwise satellite on everything, one nation, one strategy, one policy, one label, everything, one nation. All no, take care of vaccines yourself.
And how does that? How does that?
Even clearer
Yeah.
perspective. We used to buy drugs like remdesivir. We had purchase orders that we were buying for. Those purchase orders were annulled and taken over by the central government, saying that we will be the integrator and distributor, integrator of purchases and distributor of medicine. How is it that the same government that took monopoly control of a monopoly equivalent for medicine tells the states to go and be independent buyers? And on what basis morally does it sanction the manufacturers to charge three different prices to three different classes of buyers? This is not a situation where you're protecting the two manufacturers. They are not, at least one of them is only on patent. They're not even original intellectual property manufacturer. They're replicating the AstraZeneca patent. So if they can sell to the government of India at 100, we are allowed to sell to the states and private parties at different prices. It makes no sense to me whatsoever.
So are you saying that a better model would have been for the center to be responsible for all of the procurement? And I want to add another question. You see, a few months ago, it seemed that the vaccine rollout was a highly centralized program. So I remember when Maharashtra wanted to do door-to-door inoculations, the center actually said no. Now it's gone completely the other way, where the states have been left to fend for themselves. You have foreign companies like Pfizer and Moderna refusing to engage with the states directly. And as you said, other states don't necessarily have the resources or the money. If you had to construct an ideal model, would you say that the center needs to take responsibility? And two, you did not comment on the Delhi High Court's comments that the vaccine rollout is so inefficient that some people need to be charged with manslaughter. These are the Delhi High Court's words, not mine.
Yeah, listen, it's easy for what we used to call in the trading business talking your own book. So if I say something that's already naturally in my interest to say, it shouldn't carry a whole lot of weight. So of course I'm not opposed to the Delhi court's thinking, but that's not rocket science, or it doesn't enlighten the debate. Let me answer a couple of other questions that you asked very clearly. I think the government of India should do monopoly procurement of 100% of the production of the Serum Institute and Bharat Biotech and Sputnik manufacturing, number one. My best information is, were they to do that, they can procure up to a couple of 100 million or slightly more than 200 million doses a month at the fixed rate that the government sets. Number two, should all the other vaccines have got approval of the FDA, the European regulators, those should be used here as well. I've gone through this process somewhere else. When you have allowed Bharat Biotech to do Covaxin without stage 3 trials, why do you now insist on additional trials for the sake of Pfizer and Moderna, which have already gone through trials in other countries? Again, it's this lack of consistency in logic, black for you, white for me, that really boggles the mind. Number two. Number three, and that comes to the key point, having acquired and distributed them in a way that you see fair, based on population ratios, based on whatever you see fair, come out of the way of implementation and not require that 100% of the vaccine registration should be done on Government of India database, which rural villagers can, as you said, villagers in rural areas cannot access. At least in Tamil Nadu, we have very high penetration even in villages. But many parts of India, they don't have internet in the villages. How will villages in Bihar and UP register for vaccination on Government of India website, and why should they? Right? So this logic that says, you buy but I will administer makes no sense. The logic that says, I buy and I will administer makes no sense, because they've seen it fail in Swachh Bharat, Kalyan and all, where they collect the sense, but they can't make sure it actually gets implemented. They don't have the actual implementation infrastructure. So a logical union government should acquire as a monopoly buyer, almost as a by law monopoly buyer from every user possible, distribute it to the states as they see fit and fair, and then allow the state to operate as they see fit with their capabilities. It is not a complicated model. It is a simple black and white model that can be implemented today and produce fantastic results. After all, the Government of India in the budget, the Honorable Union Finance Minister said that they have allocated 35,000 crores for vaccine procurement. At 100 rupees a dose, that is 350 crore doses. 350 crore doses is more than enough to vaccinate everybody in India twice. So I don't understand where the complexity comes from.
Let me ask you this. That was very clear, but what is the biggest challenge or the difficulty that you face as a state representative today in dealing with the center on this COVID crisis? Do you feel that the Prime Minister and the Chief Ministers are all on one word? In the past, in other public statements, you have criticized the Prime Minister's communication on this pandemic. You have said, firstly, it's not clear. Secondly, you have raised the issue of being a Tamilian and having to listen to a national leader in Hindi, saying that most people don't get it. In terms of center-state synergy, where do we stand right now? You've made some scathing comments on the GST Council being, for example, a rubber stamp. But in terms of the federal spirit in handling this crisis, is it alive or is it dying?
Well, let me break that into three clear parts. It's not my role to interact with the center as far as COVID is concerned, so I don't want to comment on it. It's the health minister and the chief minister who do those interactions. I don't want to comment on what they experience or not, number one. Number two, I did not mean any disrespect. I was asked a question, what do you think of the Prime Minister's speeches? I said, I can't understand them. They are in Hindi. And since I can't understand them, I don't listen to them. I read the newspaper the next what he has said. It is a simple. It is not intended to be kind of adversarial. It's not intended to be what can I say? I can't understand how many people spend 20 minutes in front of a TV trying to listen to something in a language they don't understand. I'm shocked why that became news. If I can't understand, of course I don't listen to it. I go read the paper the next day. Somebody has translated for me what the message was. Now come to the separate. Are state-center relations at a bit of a kind of impasse? And the answer is yes. And that was before GST, but GST has certainly exacerbated it. And just I'm a finance minister, let me stick to my portfolio. On my portfolio, I'll give you 3 or 4 reasons why. Over the last 6-7 years, the amount of taxation that the center puts into cesses and doesn't divide with the states has gotten very high. And therefore, we're getting less and less of our share. Over the years, the amount of constraints and regulations the center puts on the state in its own finances has gotten very high. For example, they now say that somebody like the World, we are happy to work with, we have a long history. They say the World Bank can only do one project. Now, the World Bank will go wherever it can get work done. And if Tamil Nadu has 3 good projects, the World Bank is willing to finance that. But the center says no. Now, you have, for various reasons, they have constraints on how much you can borrow. So effectively what I'm saying is they behave like a big brother and don't allow us to function to our potential talent. Now you bring in issues like the GST Council, which were ill-formed, are constitutionally kind of amorphous and not yet clear after 3-4 years of implementation exactly what should or shouldn't happen. And then what was the nature of the contractual or the legal obligation for that? Anyways, then they say no, you won't borrow. Then they say no, you borrow. No, it was meant to be a grant, but then we'll borrow and lend it to you back to back. So I'm saying that the nature of, relationships don't break or don't get frayed by one issue, right? Just like human relationships, state-to-state relationships get affected by a gradual progression of a series of issues. And at this point, I would say that we reached a point where the center has an enormous amount of authority and control, much more so than at any point in India's history or potentially any institution, but doesn't really have compassion or the kind of with it. And so we find ourselves at this impasse, is my personal kind of feeling based on the events of the last, let's say, few years.
Yeah. Yeah. Let me ask you this. 2 different points here, but just staying on the GST Council for a bit and how you define that impasse. The Goa finance minister and you had a bit of war of words, and you just for calling Goa a small state, he said you'd insulted Goa. You refused to apologize, and you actually said you felt bad for I'm paraphrasing you. You said that you felt bad for the people of Goa to have such a minister. Since you've taken charge, you have actually been uncharacteristically blunt for a politician. You had this altercation with the Goa minister, but you also had a very public altercation with Jaggi Vasudev of the Isha Foundation over who should control temples. And then you suddenly said, I'm not going to talk about this anymore. Why did you talk about it so bluntly and then stop talking about it all of a sudden? We know that your family, of course, has a long history, in particular with of course, the Meenakshi temple. It's a familial, historical relationship. But why did you go all guns blazing on Jaggi Vasudev and then say, I'm not going to say anything about this anymore?
Yeah, so let me break that into two questions. These are very important questions. As far as Jaggi is concerned, it's very clear. I didn't say anything before that I didn't say after. I didn't say anything after that I didn't say before. The issue had already started well before I became a minister. There had been an interview that the Hindu newspaper conducted after I became a minister, asking me that they wanted it based on some financial aspects. I gave that interview. In the course of the interview, they asked me some questions about Jaggi Vasudev, which I said, what I said, consistent with two things, my earlier statements and the black and white documentation in the Government of India's Controller and Accountant General's report that I had read as an MLA and a Public Accounts Committee member. I didn't make up stuff. There was data, government data showing that they were in violation. The Hindu chose to put that as two different articles, one on the financial part and one on the Jaggi Vasudev part, and therefore it stoked a controversy after I had become minister. Now, when people accuse me of being personal, I just added enough data to show that it was not personal, black and white documentary evidence from the government of India, not just the government of Tamil Nadu, but the government of India. Keeping on answering questions where my position was not changing, the facts were not changing, but continuing to focus on something that was not my portfolio, not my interest. I happened to answer a question that came during a debate. Other than that, I had no interest. It wasn't like my day job to go and prosecute violation. It is a violation. It is in the books. It is in the law. There's no question. But it wasn't my prosecuting that. So I just stopped because I was getting dragged unnecessarily into something that was not a minister while I was in opposition. It should have stopped maybe 2 weeks earlier and it stopped weeks later. That's it. There's no other context to it. They are in violation of the law. That's the government of India. Now let's move on to the Goa. My concern, Minister, was if he had not gone out of the meeting and press conference making allegations against me, I would certainly have not brought this up into the public. It's not the job of a minister to do this. But once he went and made blatant falsehoods onto a press conference, we're having substantive discussions of what should the GST Council approve, what should it ratify, and what should only be informed to 8 months that the GST Council had not met. Were those simply to be for information? If so, some ministers felt it would be illegal and challengeable in court because constitutionally, council only had to approve it and not other people, and multiple people had a chance to speak. And this individual minister from Goa was given in my opportunities to keep on the same points. When points started getting very kind of political, equivalent of rabble rousing that happens on the streets, where a warlike footing, it's like a nationalist, is this what is worth? The equivalent of kind of, anti-national urban naxal kind of discussion started coming into a GST meeting. So at that point, I made only one statement. I said, I don't think it's appropriate that anybody politicizes and talks with questioning the intent or the kind of good faith comments of any other ministers. And it is particularly galling to me that such a questioning of good faith intent comes from a minister of a small state who happens to question the intent of ministers of people or West Bengal or Punjab who represent crores and crores of citizens. How appropriate that they question our intent. Now, as I've said publicly, the Union Finance Minister, the Honorable Minister, corrected me and said, Honorable Minister of Tamil Nadu, in this council there are no big and small states, there are only states. Of course, that's neither geographically true nor demographically true. Of course, there are small states, but I she meant, which is one state, one vote. No problem. The problem arose where the next 6 agenda items, states including Goa, including Mizoram, which had some matter there, including others, multiple times said we cannot go for example, this ease of doing business, filing returns only every 3 months or making payments every 3 months. Or we need to have cesses because we are states, because we need special consideration. So my question then was, how does it that when I say something, you say there are no big or small states? But when it comes to certain policies, certain people are allowed to say, because they are small states, they should get special consideration. Which goes back to the basic point. This notion of one nation, one size fits all, homogeneity and everything is fundamentally a flawed notion. Whether you like it or not, it doesn't work. Everybody is different. Everybody needs to have considerations of their own. Even between my district and the next district, taken a different strategy. Even between the village and the city of the district, taken a different strategy. This notion that somehow there can be one kind of universal diktat of a design of a program in Delhi that works for every state equally well the same way. Before we complain, the small states are about it. So the sooner we wake up and see, the better we are. The irony of all this, the greatest irony, by far the greatest irony, is that the single champion of the notionalism of individual states' rights, of unique solutions for unique states, by far the single biggest champion of this was Mr. Narendra Modi for the 13 years that he was Gujarat Chief Minister. So that's why I'm taken aback.
Yeah. Can I ask you though, if you can hear me, Dr. Thiagarajan? You were saying that Mr. Modi used to be a big champion of federalism, and that's why you think there's been a contradiction. If you can hear me and you just want to complete that point, do go ahead, and then I have a couple of other questions for you on the Sadhguru question. I can see, yeah, there you are. You were wanting to complete that point about the irony of the Prime Minister when he was Chief Minister being a big champion of federalism. So just go ahead and complete that point and then we'll move on.
No, so I'm just saying, the hallmark of character is consistency. If you have a principle, you must hold that principle irrespective of which place you sit. You cannot be like the old joke goes, where I stand depends on where I sit, in ruling or opposition or in center or state. So I just think that, people who understand the value of federalism should espouse federalism, whether sitting as Chief Minister or Prime Minister.
I just want to briefly have one follow-up question on what you said about Jaggi Vasudev. You said it's not my day job. I'm not an IPS officer. I made my point. But if the audits that you quoted actually reveal a violation of the law, which is the argument that you've made, as a representative of the government, why is it not your job to pursue that? I mean, either there is a violation or there isn't a violation. If there is a violation, there should be action. If there isn't a violation, then you said something wrong.
Yeah, I don't know how you think governments work, but each minister is given a different portfolio with a different set of parameters in which to work. So the Finance and Human Resources Minister, I do what is in my job. I hope you have enough understanding of government to understand that if something is in a CAG report, it must have already gone through 4 or 5 fingers of trying to fix it. You see how the CAG report works. You have to finish the accounts. Then somebody has to clear it. Then you have to get the CAG auditor to come in. It's 1 year. 1 year that has to be internally discussed with the government. Then you have to find no resolution. Then it has to get included. Then it has to go to Delhi. And the actual one human being, CAG itself, has to sign that report. Only one person in the whole of India signs every state CAG reports. The minute it gets into that report, it is no longer fixable by the government alone. Because once it has to come back, get placed on the table of the House in the legislature. then get taken up by the Public Accounts Committee, which is a subcommittee or a committee of the legislature of elected MLAs, and it has to go through a process. Now, you don't need to take my word, it is in the CAG report. You don't even need to take the CAG report. As you know, there have been documented letters from the Isha Foundation to the government of Tamil Nadu saying, yes, we agree we are in violation. Yes, we agree we never took permission. Yes, we agree XYZ. Now give us retrospective clearance. Give us retrospective. Now, this must be taken up by the Revenue Department or the Forest Department or the Commercial Tax Department about tax violations. Or there are, for example, allegations of some violations in the United States. Those should be taken up by the United States government. It's not my job because I am the Finance and Human Resource Development. I have finances, pensions and pension benefits, planning, and personnel and administrative reform. So I look at what my job is. Somebody else will look at what their job is. That's how democracy works.
All right, let's come to your area of expertise, which is finance and the economy. I want you to take a big picture. You know, we can discuss Tamil Nadu and its finances and its economy some other time. This pandemic and a series of lockdowns is going to ravage this country's economy in a way that we aren't going to understand till this is all over. We had an initial report from Mahesh Vyas of the CMIE saying 97% of Indians are poorer than they were before the pandemic. He's also been documenting of how millions of Indians, salaried Indians, have lost their jobs. I don't know if the economy is getting the attention that it should, unlike countries like the United States, where the fiscal fix was almost an accompaniment to the pandemic. So I just want to spend the last 2-3 minutes that we have with you just talking about the economy a bit. Go ahead.
Yeah, I don't find the CMI report unexpected. It's alarming, it's disheartening, but it's not unexpected. You have to decide what your priorities are. The good identity of a politician is that you start with values and you start with a philosophy, and then you implement all your schemes and your plans and your economic models and your budgets and your subsidies and everything in line with that. So in Tamil Nadu, my chief minister has been saying, and I have been echoing, that our greatest concern about the pandemic, Tamil Nadu is a relatively wealthy state. Tamil Nadu is relatively unscathed escape from this. Tamil Nadu is relatively well positioned to bounce back. There's an article in the Wall Street Journal this morning, you should read it. How the US is bouncing back like never before because this was a disruption of natural economic activity as opposed to a financial crisis or economic crisis. So, depending on the situation you were in when the crisis started, will of course determine a lot of what happens when you get out. But it also varies a lot state to state. So in my state, my leader has been very clear that our job is inclusive growth. Our job is to reduce the kind of disparity, to reduce the Gini coefficient and take everybody along. So we have focused our efforts a lot. Much of the money, 80% of the spending is on the lowest, weakest segments of society, the ignorant workers, the unorganized sector, the stay-at-home mothers and house leaders. And that's where we feel we need to bring the demand back up. We have a demand problem across the country, which is the first time, and this was before COVID. Before COVID, we had a demand problem. I don't want to get into why, because then people accuse me of politics. But factually, we had a demand problem, which was a unique outcome. So in that demand problem, we already should have been focused on trying to bring, because the more tax cuts you give, the more, no factory owner is going to build a new factory when the old factory is running at 60% utilization. No services company is going to integrate office space when they don't have enough workers to fill not enough work to fill the current workspace they have with full-time employees. So our economic philosophy matches our social philosophy of inclusive growth, opportunities for all, and to keep the bottom of the pyramid as high up as possible. The top will take care of itself. That's how human nature is. And so I would say it is dramatically opposite to the government of India's philosophy and actions as envisioned by its tax policies and economic policies over the last, let's say, 7 years. The government of India has greatly increased the ratio of both cesses and indirect taxes, which are inherently regressive in its total income, and has greatly reduced the ratio of direct taxes, which are progressive and divisible pool taxes. This is your actions tell us your philosophy. Your words don't mean that much. Your actions and the outcome of your actions will tell us what your true intent is, because we don't think you're doing it accidentally, right? So the outcome is very clear, that this government has been the exact opposite economic philosophy of what we in the DMK and in Tamil Nadu for the bulk of the last 70 years, excluding maybe the last 4, have done.
I have to ask you one question related to the pandemic. The center or the BJP in particular keeps targeting Tamil Nadu for vaccine hesitancy and vaccine wastage. How do you respond to that charge that often comes from the BJP and its supporters?
Yeah, listen, I don't know what happened when we were not in government. There was never a question of hesitancy. I think we are the land of rationalism. We have the greatest higher education levels. Average education is high school graduate, 40% gross enrollment ratio into higher education of all college-going kids, college-eligible age kids. So I believe there was vaccine hesitancy. It is a possibility that there was wastage because of mishandling, because of previous regimes, administrative focus or elections or whatever. I can guarantee you today we were 0 doses yesterday. Last night we got 17,000 doses for the district of Madurai. I can guarantee you that either by tonight or tomorrow morning we will have used up all of them, because we have 74 or 76 centers where we are vaccinating, and whoever shows up gets, and we prioritize, medical priests today, starters, crematorium workers, of course, we already started doctors, nurses, etc. So in Tamil, I assume that Madurai is an example. And my leader spoke in Coimbatore yesterday and said the second highest allocation of vaccines across the Tamil Nadu after Chennai district was Coimbatore district. So I assume that we are using up our vaccines as rapidly as we can get them. And what happened before my government came to power, I neither have the data nor do I want to kind of venture or hazard a guess as to why or what.
Okay, fair enough. A last question, and you've been asked this a million times. Sorry. Yeah, the last question is this, that you've been asked this a million times. Sorry, complete your point.
I just want to make the point that our government has been in office for less than a month, right? We were sworn in on the 7th. The swearing in only happened on the 11th. The speaker was elected on the 12th. So really, we have been in the field as fully constitutional, legitimate MLAs and ministers only from the 12th of May till today. So I think, asking me to comment about anything before that is not a fit question. Sorry.
Yeah, that's fair enough. I mean, I've raised the point that is often raised in the context of Tamil Nadu. You've given your answer. Let me close the interview with something very different, and it's also something you've been asked before, but I'm going to see if I can get something different out of you. You've often spoken about being a religious person, a devotee in a party that is statedly atheist. I just want to know, because you've said you've had no problems. You had told Karunanidhi about this. Today is a special day when it comes to remembering Karunanidhi. I just want to ask you if you ever had any arguments with him about atheism versus religion. Have you had any of those interesting conversations that you think is good to share with us today?
No, listen, I don't go around broadcasting my faith. My faith is visible on my forehead and in my actions. When I'm asked, I say that I believe in God, I believe in good deeds. I believe that my life turned out because of the good deeds of my fathers. I believe that by doing good deeds, I'm accruing benefits to children. But that's when I'm asked. I don't go around talking about this every day. Where you're making a mistake, I think, is in calling the DMK an atheist party. As I made only one observation. When the nomination filing for MLA candidates within the DMK party happened, though the nomination filings were kept open for, I think, 14 days or 13 days, 90% plus of all filings happened on the one day in the 1.5 hour periods that were considered auspicious under the Hindu kind of, mores, number one. Let me say one more thing. Every single time I've ever gone campaigning, in 2016 or 2021, every single officer of the DMK who's in charge of that corporation ward or that division starts the day by going to a temple and offering a prayer before we do the day's campaign. So I think the disconnect is not with me. The disconnect is with this notion that the DMK is an atheist party. It's hard. I mean, I'll just ask one question. Do you think it's possible in Tamil Nadu, the most practicing Hindu, broad tent, democratized religion state, for a party that is atheist to win 2/3 or 75 or 70% of the seats? It's just not realistic. I mean, this whole notion is a fallacy.
That's very interesting, and I guess I've often thought that you can be culturally rooted, often including in religious rituals, and not necessarily be institutionally religion. But we'll leave that debate for another time, because it's. You want to say something? Go ahead.
I have two important points. Points I want to make. You can cut it from the interview, but if you have 2 minutes, I want to make two important points.
No, we won't cut it. You're live. You're on live. You're on live, so we're not going to cut anything. But
okay. Periyar himself said that I have no problem with the notion of God. The God that you say that requires sacrifice, that stratifies society, that says this caste can come in and that caste must stay out, that women should not be allowed in when menstruating. When, this kind of God that you say this is the norm, I have a problem with. But if there is a God for whom that these mores are not there, that all are equal, that you don't have to give anything to go in, that you don't need an intermediary like a priest. If there is such a God, then I have no problem following that God. And for saying so, I'm being called an atheist. An atheist, meaningless term. It says I believe in nothing. Who believes in nothing? Everybody believes in something. Number one. Number two, more than Periyar, and Anna is the right person to talk about this. Anna founded the DMK, not Periyar. Periyar founded the DK. Periyar founded the self-respect. The DMK was founded by Aringer Anna. And Aringer Anna says, I am a rationalist. I am against what he called mood and nambike, or blind faith, which says, for example, that a 25 or 30-year-old woman should jump into the funeral pyre of her husband because the husband died. I am against that kind of blind faith. I am a rationalist. But if you ask me, does belief in God help society? Does it make for a better man? He says, yes, I believe that. I believe that belief in God makes a man more pious, more God-fearing, therefore more constrained in their behavior, more considerate to their fellow man, and likely, like me, to say, I want to leave good deeds behind for my children. So he says, when you have believers who do it that way, then actually they are a boon to society, because if people thought like them, they would be better human beings. And to the extent that they are better human beings to their fellow human beings, then the notion of faith in God is actually good for society. This is Aringer Anna's words. So if the founder of the DMK said so, and said, Ondre Kulam Oruvane Devan, all humanity is one, there is a God, all one God, universal God, then surely labeling the DMK as atheist is just a political canard.
Fair enough. I just want to end by sharing with you that I saw a small scene in a village in Salem, in your state, where there was a temple, then there was a statue of Gandhiji, and he was holding his famous stick in one hand and the Constitution of India in the other, and then right next to it, there was a dargah. And I thought that religion, reason, and the Constitution all coming together was the country that I believe in and that I hope for. And I think that's really, in some ways, I'm paraphrasing what you've said, that reason and religion and principles of equality and law is what this country was built on, and should continue to be built on, and we should continue to strive for. Dr. Thiagarajan, it's been a pleasure. Thank you. We hope to have you back very soon, but I know you have a state to manage and a pandemic to handle and an economy to look after. So thank you very much. It's been an absolute pleasure. Thank you very much, and take care. Bye-bye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.